Most people associate cancer with symptoms like fatigue, weight loss, or unexplained pain. But what if one of the earliest signs wasn't something you could see or feel? What if it was something you could smell? Recent scientific studies have shown that cancer can subtly alter the way your body works, especially its metabolism. These changes can lead to the release of specific chemical compounds, known as volatile organic compounds, which may affect your breath, your skin, and even the smell of your sweat. In many cases, these changes are too subtle for the human nose to detect, and yet they can carry important diagnostic clues. In fact, researchers have already identified these scent patterns in patients with lung, skin, and bladder cancer. Some studies even suggest that trained dogs can detect cancer in its early stages, simply by recognizing these distinct chemical odors before any clinical symptoms appear. While the science behind this is still developing, one thing is becoming increasingly clear: persistent, unusual changes in body odor may be worth paying attention to. They may not always indicate something serious, but sometimes they can serve as one of the body's first quiet warnings that something deeper may be happening beneath the surface. In today's video, we'll explore 8 cancer-related body smells that often go unnoticed, but could offer powerful clues for early detection. Let's take a closer look at the research, the smells, and what they could mean for your health. Did you know that cancer can silently alter the body's chemistry long before any visible symptom appears? One of the most intriguing and subtle ways it does this is by disrupting your metabolism, which leads to the release of unique chemical compounds. These compounds, completely invisible to the eye, can change your body odor, the scent of your breath, even the smell of your sweat. While these shifts are often too subtle for the human nose to detect, scientists have discovered something remarkable: your body may already be giving off warning signs, and dogs can smell them. In fact, trained detection dogs have shown astonishing results in identifying certain types of cancer simply by sniffing a person's breath, urine, or skin. Studies have found that dogs can detect lung cancer, bladder cancer, and melanoma with accuracy rates of up to 97%, sometimes even before medical imaging finds a tumor. How? Their sense of smell is up to 100,000 times more sensitive than ours. They're able to identify volatile organic compounds, VOCs, microscopic odor molecules released by cancerous cells, that escape through the skin or are exhaled. These canine abilities have sparked global interest in the development of electronic noses, advanced diagnostic devices designed to mimic the dog's olfactory system and analyze the chemical fingerprint of disease. Though still in development, these tools may one day allow doctors to diagnose cancer through a simple breath or skin test. But until such technology becomes widely available, your best line of defense is your awareness. Persistent or unusual smells that cannot be explained by hygiene or diet, especially those that don't go away, could be your body's early SOS signal. It might be subtle, yes. But for those who are paying attention, it could be the clue that changes everything. So the next time your body emits an odor that feels out of place or unfamiliar, don't brush it off. It may be more than a scent, it may be a sign. And recognizing that sign could be your first step towards saving a life. 1. The hidden mold, the mouth and throat cancer warning. Mouth or throat cancer is a serious condition that can be difficult to detect in its early stages. One of the most surprising and little discussed signs of this disease is the peculiar smell that resembles mold or rotting wood. This odor is caused by several factors, including secondary infections, tissue necrosis, and the release of volatile compounds from tumors in the mouth or throat. As the cancer progresses, these compounds accumulate and generate the characteristic odor. People around you may notice this smell when talking to someone who has the symptom, as it is most noticeable on their breath. Unfortunately, it is often associated with poor oral hygiene or dental problems, which can delay seeking medical help. The musty odor is often accompanied by other important signs. These include persistent hoarseness, difficulty swallowing, sores in the mouth or throat that do not heal, white or red spots in the mouth, and even unexplained ear pain. If the musty smell is present along with these symptoms, it is essential to see a specialist, such as an otolaryngologist or an oncologist. Tests such as biopsies, CT scans, or MRI can help identify the cause of the problem. Although mouth or throat cancer is a serious condition, its chances of cure are significantly greater when diagnosed early. Therefore, never ignore changes in breath or other unusual signs related to the mouth and throat region. If you notice this persistent smell or other associated symptoms, take action. The earlier the disease is identified, the better the chances of successful treatment. 2. The odor of decomposition, the clue to colorectal cancer. Colorectal cancer ranks among the most deadly cancers worldwide, yet its earliest signs are often brushed aside or mistaken for ordinary digestive issues. One such warning, rarely discussed, but deeply important, is a distinct change in the smell of your stool. The odor may grow much stronger, linger longer, and begin to resemble the smell of decomposition. This shift isn't random. As colorectal cancer interferes with the digestive system, it disrupts the breakdown of food, and leads to the buildup of toxins and gases that alter the natural scent of bowel movements. It's the body's quiet signal that something inside is no longer functioning as it should. Now, it's true that fecal odor can vary based on what we eat or medications we take. But when the smell becomes consistently foul, unexplained, and unusually intense, it's time to take it seriously, especially if it's accompanied by other symptoms like blood in the stool, persistent abdominal pain, irregular bowel habits, or unexplained weight loss. What makes colorectal cancer especially dangerous is its stealth. Many of its symptoms, including changes in odor, only appear once the disease has already advanced. That's why recognizing subtle shifts, like the one you might dismiss as just a bad smell, can make all the difference. If you notice ongoing changes in your stool's odor that don't resolve, don't wait. Talk to your doctor. A colonoscopy, stool analysis, or imaging scan could reveal what your nose already suspects. The good news is that colorectal cancer, when caught early, is highly treatable. Listening to your body, and yes, even to its odors, can be a powerful step toward protecting your life. 3. The sweet that scares, the smell of breast cancer. Breast cancer is one of the most common cancers affecting women worldwide, and while it's far less common in men, it can still occur. What many people don't realize is that beyond the usual warning signs, this disease can sometimes send out a signal through smell. In certain advanced cases, a sweet but unpleasant odor may begin to emanate from the skin, especially near open wounds or ulcers on the breast. This isn't just a matter of hygiene. It's the result of tissue damage, inflammation, or infection caused by cancer cells multiplying uncontrollably. As necrosis sets in, the body releases chemical compounds that produce this distinctive, persistent scent. Because the smell can be mistaken for minor skin infections or poor hygiene, it's often overlooked. But when it doesn't go away, it could be your body's way of saying something far more serious is happening beneath the surface. Of course, this odor rarely comes alone. It often accompanies other classic signs of breast cancer, like lumps in the breast or armpit, skin that changes color or texture, unusual nipple discharge, or persistent pain in the breast area. If these symptoms appear together with an unusual odor, it's essential to seek medical attention immediately. The real danger lies in underestimating early signs. Many people wait, thinking it's nothing, but that delay can cost valuable time. The truth is, breast cancer is highly treatable when found early. Recognizing subtle signs, like this distinct smell, could lead to earlier diagnosis and far better outcomes. So if you or someone you care about notices a lingering, sweet, and unpleasant smell from the breast, or any other concerning change, don't wait. Talk to a healthcare provider. A clinical exam, mammogram, or ultrasound could provide answers when they matter most. Early attention saves lives. Listening to your body might just make all the difference. 4. Sulfur in breath, a sign of stomach cancer. Gastric cancer is an insidious condition that often presents with vague symptoms that are difficult to detect. However, one of the most notable signs may be on your breath, the smell of sulfur or rotten eggs. This odor occurs due to improper digestion and the release of sulfur gases in the digestive tract. When the stomach is affected by cancer, it cannot process food properly, resulting in the production of volatile compounds with a characteristic smell. Bad breath related to gastric cancer is persistent and does not go away with oral hygiene or changes in diet. It can be confused with minor gastrointestinal problems such as acid reflux or gastritis, but its persistence should serve as a warning. In addition to the smell, gastric cancer can bring other symptoms that reinforce the need for medical attention. These include abdominal pain, a constant feeling of a full stomach, loss of appetite, frequent nausea, and in advanced cases, blood in the stool or vomit. One of the reasons for late diagnosis of gastric cancer is the similarity of symptoms to more common and less serious conditions. The smell of sulfur, although subtle, can be one of the first signs that something more serious is going on. Being aware of this odor and associated symptoms can be the difference between detecting the disease early or when it is already at an advanced stage. If you notice persistent changes in your breath or other digestive signs, see a gastroenterologist for an evaluation. Remember that gastric cancer, when diagnosed early, has more effective treatments and a greater chance of success. 5. The horror of rotten meat, a skin cancer warning. Skin cancer, particularly melanoma, is among the most dangerous forms of cancer, and often, its early warning signs go unnoticed. But one unusual symptom that many people aren't aware of is a distinct, unpleasant smell. In advanced stages, melanoma can lead to tissue necrosis, where cancer cells destroy surrounding skin and release volatile compounds into the air. As a result, patients may notice an odor resembling rotting flesh or decaying meat, a smell that can linger near wounds or skin lesions that won't heal. This odor often comes from areas that are easily overlooked, such as the back or scalp. Because of its location, and the fact that the scent can be mistaken for poor hygiene, infection, or even reaction to skin products, many people dismiss it as something minor. But ignoring this smell could mean ignoring one of your body's most critical warning signs. Melanoma doesn't always begin with pain. It might start as a mole that suddenly changes in color, size, or shape, or begins to bleed or itch. When these symptoms appear alongside a strong, foul smell from the affected area, the urgency for medical evaluation increases dramatically. Melanoma is aggressive, but it's also treatable if caught early. That's why paying attention to the small signs, even those as subtle as an unusual odor, could be life-saving. If you notice a persistent, foul smell coming from a skin wound, or if something just doesn't seem right, don't wait. Schedule a visit with a dermatologist for a proper examination. It may seem like a minor issue on the surface, but beneath it, there could be something far more serious. Early action makes all the difference. 6. An alarm in urine, the smell of ammonia from the kidneys. Kidney cancer is a serious condition that often develops silently. However, one of the most unusual clues the body can give is the smell of urine. A strong, pungent ammonia odor may be one of the first warning signs. This smell occurs when the kidneys, which have the function of filtering the blood and eliminating toxins, begin to fail. With cancer affecting its functioning, there is an accumulation of chemical byproducts in the body, such as urea, which generates the characteristic smell of ammonia. It is important to highlight that not every ammonia smell indicates cancer. Urinary tract infections, severe dehydration, and high-protein diets can also cause changes in urine odor. But if this smell is persistent and accompanied by other symptoms, it is essential to investigate. Symptoms that often accompany kidney cancer include back pain, blood in the urine, intense fatigue, and unexplained weight loss. These signs, combined with the strong ammonia smell, should not be ignored. An additional problem is that people are often hesitant to seek help because they believe the symptom is not serious. However, kidney cancer is more likely to be treated successfully when diagnosed early. Paying attention to changes in the smell of your urine can make all the difference. If you notice this odor associated with other symptoms or if it appears inexplicably, make an appointment with a doctor immediately. 7. Metal in the air, a danger signal in the blood. A strange metallic scent lingering on your breath or skin may seem like nothing more than an odd moment, but for some, it could be one of the first silent signs of something far more serious: blood cancer. People diagnosed with leukemia or lymphoma often report noticing a metal-like odor, described as similar to rusty iron or old coins. This peculiar smell doesn't come from external sources. Instead, it's a result of internal chemical changes, specifically, alterations in iron levels and other blood compounds, caused by cancer cells disrupting the production and destruction of healthy blood cells. As the body's chemical balance shifts, so does its scent. The odor is typically most noticeable after mild physical activity or during periods of heavy sweating. And because it doesn't cause pain or discomfort, many people brush it off. They may blame it on deodorant, diet, or even the weather, never suspecting that their body could be quietly signaling distress. But here's why this matters: this metallic odor rarely appears alone. It's often accompanied by other red flags like persistent fatigue, low-grade fevers, frequent infections, and unexplained weight loss. Together, these symptoms paint a picture that should never be ignored. Leukemia and lymphoma can develop quickly. Yet when caught early, they are also more treatable. That's why recognizing something as seemingly insignificant as a lingering metal scent could actually lead to life-saving early diagnosis. So if you detect a persistent metallic smell, especially one that lingers despite good hygiene, and you're also experiencing other concerning symptoms, don't wait. Listen to what your body might be trying to tell you. And get it checked. Early awareness can save your life. 8. The sweet nobody wants to smell, the smell of lung cancer. Lung cancer is one of the most silent and dangerous forms of the disease. It can develop without showing visible symptoms for a long time. But in some cases, there is an unexpected sign: the smell. People with lung cancer may report a sweet, slightly fruity odor coming from their breath. This smell is caused by the release of volatile organic compounds in the lungs. These compounds, generated by the altered metabolism of cancer cells, accumulate and can be detected in the breath. Although this smell is very similar to that of fermented or spoiled fruit, it is different from common bad breath. It does not disappear easily with oral hygiene and, above all, tends to be persistent. Unfortunately, this sign can go unnoticed for months, as it is easily confused with other conditions such as digestive problems or even diabetes. Therefore, it is essential to pay attention if the odor is frequent and without an apparent cause. Lung cancer also tends to present other symptoms that, when combined with the smell, should be investigated. Among them are persistent cough, difficulty breathing, hoarseness, and chest pain. If these signs are present, it is essential to see a doctor immediately. Lung cancer is one of the most lethal, but it is also one of those with the best chances of treatment when detected early. Therefore, being aware of the sweet and fruity odor on your breath can be a decisive factor in saving lives. As we've seen, the human body has incredible ways of alerting us when something isn't right. Sometimes, those signs are bold and unmistakable. Other times, they're quiet, barely perceptible changes in how we feel, how we breathe, or even how we smell. Science is continuing to uncover how cancer may trigger subtle shifts in body odor long before symptoms appear. And while these signals are easy to dismiss, paying attention to them could be one of the most powerful tools we have in the fight against serious disease. If you or someone close to you notices a new, unusual, or persistent smell that can't be explained by hygiene or diet, and especially if it's paired with other symptoms, don't ignore it. Trust your instincts. Speak to a medical professional. It might be nothing, but it might be something. And when it comes to cancer, early awareness can change everything. If this video helped you learn something new or made you think differently about how your body communicates, don't forget to like, share, and subscribe to our channel. We post weekly content designed to keep you informed, empowered, and one step ahead in your health journey. Thank you for watching, and remember, your body is always speaking. The key is learning how to listen.